Welcome to the Cenario podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
We talk a lot about being healthy, right? Like eating right and getting enough exercise. But sometimes we forget about this whole other piece, taking care of our minds.
Absolutely.
And that's where therapy comes in, or talk therapy, as it's sometimes called.
Yeah, psychotherapy.
It can be a little overwhelming, to be honest. CBT, DBT, psychodynamic therapy, and a bunch more.
Right. And it can be really tough to figure out, which one is right for you.
Exactly.
What do they even mean?
That's why we're doing this deep dive today. We're going to really try to break down these different types of therapy.
Yeah.
Using some research we found.
Give you guys a clear picture of what they are when they might be helpful.
Some therapies are all about changing the way you think and act right now.
Right.
While others are about understanding deeper emotional patterns from your past.
Absolutely.
So let's jump right in, shall we? Starting with one that a lot of people have probably heard of.
Okay.
Cognitive Behavioral Therapy, CBT.
Yeah, it's one of the big ones.
It is.
CBT is very structured, and usually it's pretty short term.
Okay.
And the key idea here, and the research really emphasizes this, is that your thoughts, feelings, and behaviors, they're all connected.
There you go.
You change one, it can have this ripple effect on the others.
Makes sense.
Yeah, it's goal-oriented too. CBT is really focused on finding those negative or just unhelpful thought patterns.
Right.
And the behaviors that kind of go along with them.
Okay.
And then actively changing them. You're not just wallowing, you're doing something about it.
I like that you're giving people a toolkit.
Exactly. It's like practical tools.
To rewrite those mental scripts.
To rewrite the scripts, yeah.
So you're not just reacting to everything.
You're in control.
You're more in control.
Yeah.
Love it.
Yeah.
So it's not just about feeling better,
Right.
but about actually changing what you do.
Yeah. Doing things differently.
What does that look like in practice?
Well, in CBT, you learn these really concrete strategies. You learn how to spot when your thinking is getting a little distorted. Maybe you're blowing things out of proportion, being super negative or assuming the worst.
Right.
And then the therapist teaches you how to challenge those thoughts.
Right.
And look at things in a more balanced way.
Okay.
You also learn coping skills for stress, anxiety, low mood, and you actually work on changing behaviors that aren't helping you.
So it's like a whole package deal.
It is a whole package deal.
Yeah.
The goal is to be better at managing your emotions.
Okay.
And making good decisions even when things are tough.
So it sounds very action-oriented.
Very action-oriented.
And our research mentions that CBT can be helpful for a lot of different conditions. Can you give us a quick overview?
Yeah, so according to the research we've got, CBT has shown really good results for people with anxiety disorders. Like generalized anxiety panic disorder, OCD.
Got it.
It's also a go-to therapy for depression,
Okay.
borderline personality disorder, eating disorders like anorexia and bulimia, phobias, and even burnout.
So if someone's listening and they're thinking, I want to really tackle my anxiety, or, I just have these negative thoughts that won't go away.
Yeah.
CBT might be a good option for them to look into.
Exactly. It's that structured problem-solving approach that makes it work so well for a lot of people.
Makes sense.
You're actively learning and applying skills to deal with what's going on inside right now.
In the moment.
In the moment, yeah.
Awesome.
Yeah.
Okay, so that's CBT in a nutshell.
Right.
Now let's talk about another therapy that's kind of related to CBT,
Okay.
but a little different.
Okay.
Dialectical Behavioral Therapy.
DBT.
DBT.
It's interesting how it evolved from CBT, but it was really designed to help people who experience emotions very intensely,
Okay.
especially folks with borderline personality disorder.
So they're feeling things on a different level.
On a different level.
Yeah.
Got it.
Right.
Now, they does pay attention to thoughts and behaviors like CBT, but DBT really emphasizes learning how to regulate your emotions, tolerate distress,
Okay.
and practice mindfulness.
So it's like CBT, but with this extra emphasis on emotional mastery.
Emotional mastery, yeah.
Riding those waves.
Riding the waves.
I like that.
Yeah.
Mindfulness, being present in the moment without judgment.
Right?
That seems to be everywhere these days.
That's a hot topic.
What are the other key areas that DB2 focuses on?
So mindfulness is one of the four main components.
Okay.
We've got emotional regulation, which is basically learning to understand and manage your emotions.
Okay.
Then there's distress tolerance,
Okay.
which is all about developing skills to cope with painful situations and intense feelings
So you don't fall apart.
without resorting to harmful behaviors.
Yeah, got it.
And then there's interpersonal effectiveness. This one focuses on building healthy relationships through communication and conflict resolution.
So if CBT is about changing your thoughts, DBT is about learning to handle those big feelings. Exactly.
It's about accepting those difficult emotions in the moment,
Okay.
but also working to change them over time.
Find that balance.
Finding that balance, a dialectic.
I see.
And, the research shows it's especially helpful for folks with borderline personality disorder,
Okay.
people struggling with suicidal thoughts or self-harm, anyone who has a really hard time regulating their emotions, people with substance abuse issues, PTSD,
Wow.
and even chronic stress.
So if you're someone who often feels overwhelmed by your emotions,
Right.
or maybe your emotions are affecting your relationships in a negative way,
Yeah,
DBT could give you the tools to take back control.
absolutely. It helps you stay grounded and in control even when things feel really intense.
It's like having a life raft.
It is like a life raft, yeah.
Right.
Yeah.
Okay, let's switch gears a bit and talk about psychodynamic therapy.
Okay.
This one feels different to me.
It is a bit different.
Like it's more about understanding your past
It is.
to help you in the present. So it's not about like quick fixes.
No, it's more in depth.
Mhm.
It's about uncovering those hidden emotions and past experiences that are shaping how you act today.
Interesting.
It's like you're an emotional house.
Okay.
And psychodynamic therapy helped you trace the blueprint back to the foundation.
Wow. I love that analogy.
It really helps you see how those early relationships, especially in childhood, are still affecting you as an adult.
So it's like peeling back the layers.
Peeling back the layers.
You see the roots of your emotional patterns.
Exactly.
How does that actually work in therapy?
Well, you start by looking at those recurring emotional patterns that you might not even realize are there. There's a big focus on self-reflection,
Okay.
really getting to know your inner world.
Okay.
And often you explore past traumas and childhood experiences with the goal of processing emotions in a healthier way.
So it's about healing old wounds.
It can be.
And
Yeah.
our research suggests it can be helpful for a pretty wide range of issues too, right?
Yeah. Well, psychodynamic therapy has been shown to be effective for depression, anxiety disorders, personality disorders, relationship problems, and especially for dealing with the effects of childhood trauma and attachment issues.
So if someone is curious about why they are the way they are, and they want to go deep and understand themselves,
Absolutely.
psychodynamic therapy might be worth exploring.
It's for people who are ready to do that deep dive into their emotional history.
I like that.
Yeah.
All right, now for something totally different.
Okay.
Let's talk about animal-assisted therapy.
All right.
I'm so curious about this one.
It's pretty unique.
You're bringing animals into the therapy session?
You are.
That's amazing.
It's using that special bond between humans and animals
Right.
to help people cope with emotional and psychological challenges.
Okay.
Just being around a trained animal can be so calming.
Makes sense.
It can reduce anxiety and just make you feel better.
It's like this different kind of connection.
It is a different kind of connection. Yeah.
So it's more than just petting a dog,
It is,
although I'm sure that's nice.
of course.
But how does it actually work as therapy?
Well, it works on different levels.
Okay.
Animals can encourage social interaction and help build trust, which can be really good for people who have trouble connecting with others.
Interesting.
They can also have a physical effect, lowering stress hormones and calming those negative thoughts.
Makes sense.
And for many people, the animal is just this non-judgmental presence. They offer unconditional acceptance, can make it easier to talk about tough stuff.
I see.
It can be especially helpful for people who've experienced trauma or tend to withdraw.
So the animal provides a sense of safety.
Exactly, a sense of safety.
And our research says animal-assisted therapy can be effective for a variety of conditions.
Yeah, it really can.
Anxiety, depression, PTSD, autism spectrum disorder, even chronic illness and pain management.
It's pretty amazing, right?
It is.
And for people who find traditional talk therapy difficult,
You know, maybe it's intimidating or uncomfortable.
Hmm.
The animal can make it feel safer and easier to open up.
That makes so much sense.
Yeah.
Okay, so we've got all these different types of therapy.
Right?
How do you choose?
Yeah, good question.
It's still a little overwhelming.
It can be.
What are some things people should consider?
Well, the research gives us some great pointers. First, think about what you're struggling with specifically.
Okay.
Certain therapies are more effective for certain conditions.
Makes sense.
Then think about what you want to get out of therapy.
Right.
Are you trying to change specific thoughts or behaviors?
Mm-hmm.
Do you need to process past experiences? Or are you hoping to improve your relationships?
Got it.
Your personal preferences matter too.
Of course.
Do you like a structured approach like CBT or DBT?
Mm.
Or are you drawn to something deeper and more exploratory like psychodynamic therapy?
Right.
And finally, find a therapist who specializes in what you need
Okay.
and whose style you feel comfortable with. So it's about understanding yourself
Right.
and then doing your research to find a good match.
Exactly.
Now, regardless of the type of therapy,
Yeah.
what are some of the general benefits people experience?
Oh, the benefits can be huge. Therapy can really improve your emotional well-being. You understand and manage your emotions better.
Okay.
Anxiety and depression often decrease.
Right.
You learn better coping strategies for stress, trauma,
Mm.
difficult situations.
Okay.
Your relationships can improve because you're communicating better and setting healthy boundaries.
Mm.
You become more self-aware so you can recognize those unhelpful patterns and make better choices.
I like that.
And ultimately, it strengthens your mental health in the long run.
Okay.
Makes you more resilient.
Makes you more resilient.
Less likely to have problems in the future.
So many good things can come from therapy.
There really can.
But how do you know when it's time to actually seek help?
Yeah, that's a good question.
What are the signs?
The research highlights some key things to watch out for.
Okay.
Persistent sadness or hopelessness
Mm-hmm.
that just won't go away. Excessive worry or anxiety that's interfering with your life.
Okay.
Real trouble coping with stress or past trauma.
Got it.
These are all big red flags.
Okay.
Also look out for sudden changes in behavior, especially if they're self-destructive or isolating, ongoing struggles in your relationships, or even physical symptoms like unexplained fatigue or digestive issues that seem linked to your emotions.
So mind and body are connected.
They are definitely connected.
It's about listening to those internal cues
Absolutely.
and not being afraid to reach out for support.
Right.
Okay, so let's say someone is listening and they're thinking, yeah, I think I need therapy.
Yeah.
What can they do to get the most out of it?
Well, first and foremost, be open and honest with your therapist. The more you share, the more they can help.
Okay.
It's also important to set clear goals.
Okay.
What do you want to achieve in therapy? Having those goals gives you direction.
Makes sense.
Then actively practice the techniques and strategies you learn outside of therapy.
Okay.
That's how you make lasting changes.
Mm.
And remember, therapy is a process.
Right.
Progress isn't always a straight line.
Okay.
Be patient with yourself.
Got it.
And as we said before, finding a therapist you connect with is crucial.
Right. It's a partnership.
It's a partnership.
Okay. Now, some people might be wondering,
Yeah.
does therapy actually work?
Does it work?
What does the research say?
Well, the research is pretty clear.
Okay.
Psychotherapy is effective for a wide range of mental health conditions. Our research even says that about 75% of people
Wow.
notice improvements in their mental health after therapy.
That's a lot of people.
It is.
That's really encouraging.
It is encouraging.
What about specific types of therapy?
Well, CBT and DBT have a lot of scientific evidence
Okay.
showing they work really well for anxiety, depression, and eating disorders.
Yeah.
And psychodynamic therapy has been shown to help people grow and improve their emotional well-being over the long term.
So there's proof.
There is proof.
It's not just a feeling.
No, it's not just a feeling.
Okay, so for someone listening who's thinking, okay, maybe therapy could help me,
Yeah.
what are their first steps?
Well, the first step is to figure out what you need.
Okay.
What are you trying to address in therapy?
Got it.
Once you know that you can start looking for a therapist,
Okay.
look for licensed mental health professionals in your area or online.
Okay.
See who specializes in what you need.
Okay.
Think about the format, too.
Yeah.
In-person, online, individual group. What works best for you?
Okay.
A lot of therapists offer a free or low-cost consultation.
Oh, that's good to know.
Yeah, you can chat with them about your needs, their approach, and ask any questions you have.
Makes sense.
And before that first session, jot down some notes about your challenges and what you want from therapy. It can really help.
It's like going in prepared.
Be prepared.
Right.
And remember, starting therapy is a commitment. It's a commitment to your well-being.
Okay.
Go in with an open mind.
Right.
Be ready to work towards your goals.
I like that.
Yeah.
Now, before we wrap up,
Yeah.
are there any practical things people should consider?
Definitely.
Like what?
Well, first off, cost and insurance.
Right.
check with your insurance company about mental health coverage.
Okay.
See what they'll pay for and what you might have to pay out of pocket.
Got it.
Time commitment is another thing. Most therapies involve regular sessions,
Okay.
often weekly,
Right.
but the length of treatment can vary.
Okay.
And we've said it before, but it's so important. You have to feel comfortable with your therapist.
You have to trust them.
You have to trust them, yeah.
Right.
And make sure you understand confidentiality.
Okay.
What you talk about is generally private,
Okay.
with some legal exceptions if there's a risk of harm.
So it's about being informed.
Absolutely.
So taking care of your mental health.
Yeah.
It's about self-reflection
Right.
and practical considerations.
Right.
But ultimately, it's an investment in yourself
It is an investment in yourself.
that can lead to some really positive changes.
It can.
And you know what?
What?
There is no one-size-fits-all best therapy.
There isn't.
The research makes that clear.
It does.
It's about finding what works for you,
Yeah.
your needs, and your goals.
Exactly.
That's CBT, DBT, psychodynamic therapy,
Right.
animal-assisted therapy.
Whatever it is,
Finding the right fit can make a world of difference.
it can really change your life.
And as you've been listening,
Yeah.
maybe you've started thinking about which approach might resonate with you. It takes courage and self-awareness to even consider these options,
It does.
to put your mental well-being first.
Absolutely.
So I want you to ask yourself, what positive changes could happen for you
Yeah.
if you took that step?
It's something to think about.
It is. Thanks for joining us on this deep dive today.
Thanks, everyone.
Thanks for tuning in to the Cenario podcast. Don't forget to visit Cenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.